What could be the reasons for fetal pole absence at 6 weeks?
In this video, we'll discuss the possible reasons for the absence of a fetal pole at 6 weeks of pregnancy. This can be a concerning finding for many expecting mothers, so let's explore the different causes and what they might mean for the pregnancy.
What is the fetal pole?
The fetal pole is the first visible sign of a developing embryo on an ultrasound. It appears as a thickening on the margin of the yolk sac and eventually develops into the embryo. The fetal pole typically becomes visible between 5.5 and 6 weeks of gestation.
Could the timing be off?
One possible explanation for the absence of a fetal pole at 6 weeks is incorrect dating. It's common for there to be some uncertainty about the exact date of conception or the age of the pregnancy. If the pregnancy is earlier than initially thought, the fetal pole may not yet be visible on the ultrasound.
What if the ultrasound equipment or technique is at fault?
Another possible reason for not seeing a fetal pole at 6 weeks is related to the ultrasound equipment or technique. Some machines may not be sensitive enough to detect the fetal pole at this early stage. Additionally, the ultrasound technician's experience and technique can also play a role in the visibility of the fetal pole.
Can an empty gestational sac be the cause?
An empty gestational sac, also known as a blighted ovum or an embryonic pregnancy, occurs when the gestational sac develops without an embryo. This can result in the absence of a fetal pole at 6 weeks. In most cases, an empty gestational sac will lead to a miscarriage.
Is a miscarriage or ectopic pregnancy possible?
If the absence of a fetal pole is not due to incorrect dating, equipment issues, or an empty gestational sac, it may be an early sign of a miscarriage or ectopic pregnancy. In these cases, the embryo may stop developing or implant outside the uterus, leading to the absence of a fetal pole on the ultrasound. The absence of a fetal pole at 6 weeks can be caused by a variety of factors, including incorrect dating, ultrasound equipment or technique issues, an empty gestational sac, or a miscarriage or ectopic pregnancy. It's essential to consult with a healthcare professional to discuss the findings and determine the appropriate course of action.